I want to talk about sepsis today and core measures. And when I think about sepsis and core measures, I think about admissions because those are the ones that fall into sepsis. So there's a lot of patients that come into the emergency department with infections. However, the ones that get transferred or discharged, those are not what we're talking about. And then when I see patients that I'm considering infection on, there's two broad groups. There's the obvious septic patient. So they come in from a nursing home and they got a fever. Anybody should be able to pick that up. And then there's the other group that's much more difficult to evaluate. That's the patient that comes in that's, say, old, weak, and dizzy. Maybe they have asthma. Maybe they're having some respiratory difficulty. The differential can be quite broad, especially with the weak and dizzy. And my approach is to think, am I going to admit this patient in the hospital? If I'm going to admit him in the hospital, my second question is there a source of infection? And if there's a source of infection, then I go ahead and initiate a sepsis order set, and I typically give antibiotics. Of course, you got to grade that in terms of how likely it is. However, if I'm admitting and I'm concerned about any infection anywhere, then there's a very good chance that they will flag later on for sepsis. The hard thing about sepsis is anytime during their stay in the emergency department, they have abnormal vital signs such as low tachypnea, low blood pressure, elevated heart rate, they're going to flag, and it doesn't all have to happen at the same time. So that's my basic approach to sepsis. I don't complicate it. I honestly don't look at the SARS criteria. I mean, certainly if there's gimmies there and they're tachycardic or febrile, that makes it a lot easier. But if it's not, I don't exclude it. And I tend to refer those patients as the cryptic septic patients. And those are the old, weak, and dizzy or immunocompromised, people with a lot of medical other issues going on. And my threshold to initiate sepsis and the bundle and the antibiotics is very low. I tend to hold the fluids until I get more information, but you usually have 3 hours to give that. So that's Sepsis 101.